Welcome to ICE Dental Systems Patient Information, a service provided by your dental practitioner to ensure you are well informed about the areas of dentistry that apply to you. This presentation covers information related to oral hygiene. To advance through or review any element of this presentation, please click on the index items on the left side of your screen. If you are not currently in your dental practitioner's office, you can ask your dental practitioner a question by clicking the Ask a Question button at the bottom of your screen. Maintaining good oral hygiene is one of the most important things you can do for your teeth and gums. Healthy teeth not only enable you to look and feel good, they make it possible to eat and speak properly. Good oral health is also important to your overall well-being. Daily preventative care, including proper brushing and flossing, will help stop problems before they develop and is much less painful, less expensive, and less worrisome than treating conditions that have been allowed to progress. The main cause of gum disease is plaque. Plaque builds on your teeth every day, and if not removed, will harden into tartar. When plaque hardens into tartar, it cannot be easily removed by brushing and flossing. Therefore, it is recommended that you floss at least once each day and floss before you brush your teeth. This will give you better cleaning and dental health. One type of dental floss does not work for everyone. Consumers can choose between waxed or unwaxed, flavored or unflavored, and regular or tape types. In general, waxed floss slides between the teeth easier than unwaxed floss. Flavored floss leaves a fresh taste in the mouth and is especially nice for those times when brushing or rinsing is not possible. Tape floss is typically thicker than regular floss and is generally favored by people with wider gaps between their teeth. Flossing helps clean teeth in the areas that brushing alone just cannot reach, between the teeth and under your gum line. Flossing and then brushing helps remove plaque, a sticky substance that accumulates and hardens over time. Left untreated, plaque deposits can eventually lead to gum disease and tooth decay. Flossing is so important because you can reach areas with floss that you cannot reach with your toothbrush. If you do not floss, you are missing more than 1/3 of the unclean surfaces of each tooth. Learning the proper way to floss your teeth is important. Your dental practitioner will be happy to demonstrate proper flossing techniques. The basic flossing techniques are shown on the following slides. To floss properly, take a piece of floss approximately equal to the length of your forearm. Wrap the floss around the middle fingers of your left and right hands, leaving approximately 2 inches free. Use your index fingers to guide the floss between your teeth. Slide the floss between your teeth and wrap it into a C shape. Be sure to wrap the floss around the base of your tooth. That is, wrap the floss around your tooth at the place where your tooth meets your gum. Wipe the tooth from below the gum line towards the biting edge of the tooth. Do this at least 2 or 3 times for each side of each tooth. Remember that each tooth has 2 sides for flossing. Please be sure to floss both sides of each tooth, and don't forget to floss the back surfaces of each of your back teeth. If you are new to flossing your teeth, you should be aware that your gums sometimes bleed when you first begin to floss. The tendency for gums to bleed during flossing will decrease as the gum tissues become healthier. Usually, regular flossing will help achieve healthier gums within several days. Once healthy, gums will no longer bleed during flossing. If bleeding during flossing persists, even after several days of regular flossing, it is recommended that you see your dentist. Floss can sometimes shred if it gets snagged on an old filling or on the ragged edge of a tooth. If this happens, you may want to try another type of floss or an alternative to floss, such as dental tape. If your floss continues to shred, it is recommended that you speak with your dental practitioner. Many people make mistakes when flossing. There are also many common errors and mistaken ideas about flossing and its importance as part of overall home oral hygiene care. Some of these mistaken ideas are: not flossing at all. Due to everyday stresses and rushed lifestyles, many people do not take a few minutes to floss. Flossing is just as important as brushing in the prevention of dental decay and periodontal problems. Not flossing daily. Flossing will not be effective if you do not floss daily. Plaque buildup occurs quite quickly, so not including flossing as part of a daily, oral hygiene, home care regimen will not be as effective in the prevention of cavity and gum disease formation. Flossing is only a means to remove food particles. Flossing is not just supposed to remove food particles, like meat, from between your teeth. The primary function of dental floss is to remove the invisible film of bacteria that constantly forms between your teeth, called plaque. Flossing should be performed between each tooth. Not placing the floss under the gum line. Not placing dental floss carefully under the gum line, the area where plaque buildup occurs most, will not be as effective in the prevention of dental decay and periodontal disease. Rushing when flossing. You cannot perform proper flossing when rushing through the procedure of removing plaque. You should take at least 2 to 3 minutes when flossing. This is a small amount of time when you weigh the benefits of good oral health. Did you know that it takes 2 to 3 minutes to adequately brush your teeth, but that most people spend less than 30 seconds brushing? Why is brushing this long so important? It all has to do with bacteria. Millions of bacteria live, work, and play in our mouths. They feed on the food left on our teeth after we eat. As a result, they produce acid which remains on our teeth. It is this acid which destroys enamel and creates cavities. Brushing removes the bacteria from our teeth so they can no longer make acid. It is important, however, to remove bacteria from all tooth surfaces. This takes 2 to 3 minutes. Brushing is an easy, convenient, and effective way to keep not only your teeth, but also the important supporting gum tissues clean and healthy. It is recommended that you brush your teeth at least twice per day and always before going to bed. It is recommended that you use a soft toothbrush with rounded bristles that will allow for gentle but effective cleaning. While it is important to select a brush that appeals to you, please ensure that your toothbrush enables you to reach all the way to the back of your teeth. There are many different types of toothbrushes. You may want to ask your dental practitioner about which toothbrush is best for you. Even with normal and careful use, toothbrushes wear out. It is recommended that you replace your toothbrush every 3 months. Proper toothbrushing should cleanse the areas where the teeth show and in the areas where the teeth grow. This means that proper toothbrushing should clean the teeth and also the gums. Step 1. To brush properly, place your toothbrush at a 45-degree angle to the sides of your teeth. Put the bristles at the place where your teeth and gums meet. Use gentle, short strokes, moving the brush back and forth against the teeth and gums. Do not brush too hard or use a scrubbing motion on your teeth and gums. It is important to know that a receding gum line is often the result of years of brushing too hard. Step 2. Use this same motion, as described in Step 1, to clean the chewing and inner tooth surfaces. To brush properly, You must clean every surface of every tooth. That means the chewing side, the cheek side, and the tongue side. Also, slow down. Please do not rush when brushing your teeth. It should take anywhere from 2 to 3 minutes to properly and thoroughly brush your teeth. Most people brush their teeth in the same pattern all the time. That means they also miss the same spots all the time. Try changing or reversing your brushing pattern on a regular basis. Step 3. To clean the inner front tooth surfaces, hold the brush upright and use gentle up and down strokes with the tip of the brush. Step 4. Don't forget to brush along the gum line and make sure you reach the teeth right at the back. Be sure to give your tongue a brushing. It'll help keep your breath fresh. You can achieve even better results with power toothbrushes that use oscillating rotating technology. Oral-B pioneered the oscillating rotating technology in 1991 and has published over 60 clinical studies demonstrating its superior performance. Now, an independent landmark study has confirmed what Oral-B knew all along. Oscillating rotating technology is superior to other power toothbrush technologies. This brushing action is very different from ordinary manual toothbrushes, as it does the job of brushing for you. Just be sure to guide the brush head to all parts of your mouth. Step 1. Guide the toothbrush head slowly from tooth to tooth, following the curve of the gum and the shape of each tooth. Hold the toothbrush head in place for a few seconds before moving on to the next tooth. Step 2. Make sure to reach all areas, including the inner surfaces and chewing surfaces and behind your back teeth. Step 3. Direct the brush head along the gum line. It isn't necessary to press hard or scrub. Simply let the brush do the work. Thanks to better at-home care and in-office dental treatments, more people than ever before are keeping their teeth throughout their lives. Although some diseases and conditions can make dental disease and tooth loss more likely, most of us have a good deal of control over whether we keep our teeth into old age. The most important thing you can do to maintain good oral health is to brush and floss your teeth regularly. Thank you for viewing this oral hygiene presentation in ICE Dental Systems. We trust this presentation has been informative and helpful as you understand the benefits associated with proper oral hygiene. To review any element of this presentation, please click on the index items on the left side of your screen.